Hello and welcome to Peepul Health, an online forum bringing you live workouts, seminars, nutritional advice and guidance, and information on overall health and wellness at the Peepul Center. My name is Sumit. I'm the head coach for the Peepul Gym and Spa department, and today we have our expert dietitian Khushbu Rawal, who is going to give us more information on food. And our today's topic is diabetes and food. So let's get straight into it. We know that diabetes can be quite tricky and challenging to manage on a daily basis, whether you're living with type 1 or whether you're living with type 2. So we've got some foods here today which will help a lot of people gain more awareness and understanding, because that's one of the things that can be the most challenging. So Khushbu, let's go straight into this. I mean, we've got foods here. So first of all, what is what? So what are these food categories?
Well, I can class these as the vegetables, the fruits, whole grains and cereals, and this we'll talk about later. So when we talk about vegetables, the bottom line is to go for foods rich in fiber, because fiber is a content that would lower your blood sugar levels and also the cholesterol levels. All the green leafy vegetables and tomatoes, peppers, they are very high in vitamins A, C and K. They also have a high amount of soluble fibers which lower your help in reducing the blood sugar levels, and also are good for many heart diseases, cancers and many other diseases.
Brilliant. So we also know that obviously leafy greens is mentioned all the time, and there's so much information out there about vegetable and fiber and how that's really important. One of the most important benefits of leafy greens and fibers is that it helps to maintain a calorie deficit on a daily basis. So if you're somebody living with type 2 diabetes, obesity, you're at a high risk of obesity. So your GP or your doctor may have recommended that you need to lose weight to keep your sugar levels, to manage your sugar levels, or not increase the risk of any further complications. So therefore choosing leafy greens is one of the best options. So Khushbu, I've read that spinach is a brilliant example, not just to maintain the calorie levels, but what benefits do spinach have for somebody with diabetes, and what are the sort of vitamins that we can get from spinach?
Well, spinach, when we talk about, is high in vitamin A, C and K, and these vitamins are really helpful when you're dealing with a diabetic patient, because usually in these patients the amount of vitamins K and D are in low amounts. So when you consume this or include this in diet, it helps in increasing those levels. And also, as I said, it's very high in soluble fibers, and these soluble fibers are really helpful. It acts like a broom in your body. So basically all the cholesterol, bad cholesterol, or the sugars, unnecessary sugars, these are all brushed out of your body. So please recommended that do include these in your diet.
That's absolutely correct. And the other important and added benefits of using spinach, kale and leafy greens is that it adds extra amount of protein to your diet as well. And this is another misconception which a lot of diabetics have. There's a lot of diets out there, Khushbu, suggest that you should only stick to very low carbs, high protein and manageable fats. Is that entirely correct?
I wouldn't recommend these specific diets at all, because it's rather to maintain a diet which helps you maintain your blood sugar levels, rather than sticking on to one diet and just strictly following it. As long as your blood sugar levels are completely in control, you can have liberty in having proteins, carbs. You need to speak to your doctor and dietitian about it. They would be of best help.
Brilliant. So we've gone through the leafy greens. We know that they are really important and they do help maintain the insulin levels, which in level will help regulate the sugar levels and the glucose in the bloodstream. So let's move on to fruits. There's a lot of misconceptions with fruit and fructose, and there's a lot of studies out there about fructose should be at a low level, but we've picked out some really good options for diabetes for type 1 and type 2. And most of the common ones are the berries.
Yeah.
So Khushbu, why strawberries, and give us a bit of information on blueberries, and we've got an orange there.
I would say the most recommended fruits for diabetics are the berries, all types of berries, whether it's strawberry, blueberries, blackberries, or cherries, whatever. These fruits really have high level of antioxidants in them. And antioxidants, as we all know, is really helpful managing health and well-being. So because of these properties in them, and as I said, they do have soluble fibers as well, so which is again a good thing in diabetes.
Brilliant. And also the other benefits of berries is that obviously Khushbu mentioned it's antioxidants, and antioxidants are great catalysts to break down energy and to catabolize protein. So these fruits, which are still in the carbohydrates group, but they have a very low glycemic index. So therefore, again, choosing these options, and in terms of hunger as well, you will feel fuller for longer. So therefore, when you feel fuller for longer, you will be consuming less calories, and your insulin will not be irregular throughout the day, and it won't spike as often. So brilliant. So what vitamins and minerals can we gain from these fruits? Khushbu, just get a bit more specific so that people get a bit of understanding of.
We all know citrus fruits like oranges, limes, lemons, they're all high in vitamin C. As we all know, vitamin C is good for immunity, and diabetics and immunity is always a concern. So including citrus fruits in your diet is always good. It's only because of their caloric content that they are prescribed in moderation for diabetics. But it can still, because of their vitamin C content and the antioxidant properties, it is still not completely prohibited in a diabetic diet. So you can have in moderation for sure.
Brilliant. And also the other added benefit is that they taste good. And we all know that sometimes, there are certain diets that are so strict, and they recommend, the food and the meals, they don't have taste at all, and they're very clean. They call them clean diets. They're not right or wrong. But again, for somebody who wants to enjoy their life living with diabetes, you can still have tasty food. Doesn't mean that if you have diabetes that you can't have tasty food anymore. No, this is incorrect. So again, this is a great option, again, to maintain and calorie levels, manage them, and also at the same time enjoy them as well because of their taste. The other things we want to go into and talk about is we've got, again, certain proteins. So I know there's a lot of people living with diabetes type 1 and type 2 who are vegan or vegetarian, and there's a lot of misinformation out there that if you are a vegan or a vegetarian, then you are not getting enough protein. Or the other information is that there just isn't enough choices or variety of protein. But this is entirely incorrect, because if you are living with diabetes, then again, lentils and different types of beans really do add the content of protein as well. Am I right in saying that, Khushbu? What other benefits do we get from beans and lentils?
Yes, of course. I mean, this is actually the basic staple food we eat. Well, this comes along as we don't always stick to one type of food. We always use a mixture of foods, a combination of foods. So this acts as a base in the food. And as you said, it's a great source of proteins in diabetics. And all these have, I won't say it doesn't have carbs. It does has carb, but all of these carbs are really complex carbs. So they take time to synthesize in the body, and hence they don't shoot up your glucose straight away. But yes, the fiber content in them is really nice, and hence they should be included in the food.
That's certainly right. And Khushbu mentioned a really important point, is that a lot of foods, they don't have just protein, but they also have content of carbohydrates as well. So food choices such as lentils and beans, especially the darker ones, they have more quantity of protein inside them per the gram, and less carbohydrates inside them. So you don't necessarily have to always go for the starchy carbs. You still can get your carbs in from these food sources as well. And also, again, they taste great. And let's talk about the cooking benefits, the amount of water that is in these food choices as well. I know obviously leafy greens have a lot more water content in them, so that's why they should be included in every meal. But how much water content does these lentils and beans have compared to the fruits?
Well, water content, I wouldn't say they have a lot of water content, because, well, when they cook, that's the cooking method that we use includes in it, that comes in play there. But water content in citrus fruits and green leafy vegetables is always going to be high. But when we talk about these foods, we really need to think about that they not only just bring in calories, carbs, and a major source of protein. So yes, and fiber, don't forget fiber as well. So
brilliant, awesome. So someone living with diabetes, we know type 1 and type 2, some of the common deficiencies vitamins is vitamin K, vitamin D, and vitamin C, as Khushbu mentioned.
Yes.
So what are the food sources that we can have that contain these vitamins and minerals?
There are many sources, as we say, like not just these grains and cereals, but like oatmeals, brown rice, apart from going for the cereals that are in daily use, like the refined flour or the plain flour. We rather go for the complex ones like oatmeals or bran rice or brown rice, barley, quinoa, and millets nowadays are more useful. So all these are really helpful in getting all the vitamins that we need for our food, daily diet. Don't just stick to one particular food or one particular type of meal. Changes is always, variety is always good actually. So,
and also to mention and add on is that there are a lot of you with diabetes that you don't just have diabetes type 1 or type 2, you may have other intolerances or conditions with it. So please do visit your GP and get some advice from your GP, or visit a dietitian, because a dietitian will be able to help prescribe you with diets and also help you make better choices and give you that extra level of education and awareness. What are some of these common other diseases that people have with diabetes too? I know IBS is one. I know that dairy intolerance or gluten intolerance can be another one. So what are other things out there that people have?
Cardiac problems are basically associated with diabetes. That's because when your body doesn't use sugars, then the fat and lipids are utilized. Cardiovascular diseases are the mainly that are associated with diabetes, and obesity is one of them. So when you're obese, when you're overweight, you are struggling to burn your fat, and these fats gets accumulated in the body, and then they cause many such problems like other heart diseases, arteries diseases. So it's always good to maintain a proper weight when you are a diabetic.
Brilliant, that is absolutely correct. And also the other option and the other discussion we want to have is we've got some other food choices here, which are, I believe they are dates, and we've got honey. So could we talk about these and why?
Well, these are quite interesting to talk about, because recently people have been using alternatives instead of simple sugars. Like when you explain to a diabetic that you're not supposed to have sugars, they would choose and try to find substitutes for it. So one of the substitutes used lately is honey. So I would say honey is really good substitute for sugar, but don't forget it's too sweet. So when you substituting with sugar, you would actually need it in a very small amount, not the exact amount as you use the sugars. So, and honey, we all know, has anti-inflammatory properties, which is good for any comorbidities related to diabetes. So it actually is helpful for the body. And the second thing is the dates. Dates are really high in fiber, and as you spoke earlier about the glycemic index, the glycemic index of dates is really low. So these, even though they are sweet, they can be included in the diabetic diet.
That is so spot on. This is it, guys, for today. Thank you very much for our video. We've got some more videos coming up, and thank you to Khushbu for our dietitian. And we'll see you guys soon in the next video.